us. It is now 23 minutes to 8 o'clock. This is Breath of Heaven on Hope FM Listen and Leave. Thank you for joining us for this wonderful time where we discuss matters health, and tonight touching on the area of the health of our bones. And this being the fourth Thursday of the month, we usually invite an orthopedic surgeon from AIC Cure International. And tonight I have the privilege of hosting Dr. Philemon Nyambati with me in studio, and we'll be discussing this whole issue of those common orthopedic injuries among children and of course among adults. And you also have an opportunity to ask your questions. In case you have a question or a comment, feel free to share with us on 20933 on WhatsApp 0717 400 555. We're also live on Facebook as well as on YouTube. Dr. Nyambati, welcome to the studio.
Thank you.
How have you been?
I'm well. Thank you, God, for a new month, a month that's almost ending.
Yeah.
And a new day. And it's a pleasure to be here, Jackson.
Amen.
Yes.
And what about your colleagues there at AICQ International? How has it been during this season?
It's a season. It has been a season of prayer and just introspection, just in terms of the happenings. Yes, that's what I would say. Yes.
And so you as Daktari Ombati, probably you have something that you'd like to share with us as a people, as the listener who is listening to us tonight, what we need to do for our nation.
The thing that have come as a Bible study that we have been meeting weekly has been prayer, just getting on our knees and just asking God to guide us, because I think there's a aspect where you have hope in our people or in a leadership and you feel probably this is not what has happened. So the thing I've seen is to look unto God and just reflect on where we were, where we are, and where we want to be. And the most important is placing our hope in God in terms of giving the leadership wisdom. So it has been about prayer, yes, and education of people. Yes.
All right. Thank you for that. It's an encouragement as well. Now we head to our subject of the day, has to do with the common orthopedic injuries, and you tell me there are many, but we will zero in on a number of them that are very, very prevalent, especially at such a time as this, and what you have been dealing with in your practice there. And you share with me that the common orthopedic injuries occur in children as well as adults. So because you mostly deal with children, you will share with us the part of the children, and then we'll go ahead and also touch on the adults.
Okay.
Yes.
So thank you for this opportunity, Jackson. So orthopedics is, we've talked about bones, actually, as you started, health of our bones. So it's just any injury, or it's called injury or trauma to the musculoskeletal system. So the things that in the musculoskeletal systems, you have the bones, the joints, the ligaments, the tendons, and the muscles. And so the orthopedic injuries, this can happen during our daily activity, daily life, and in different age groups. So what we'll just say, because first I'll just give a broad spectrum of what can happen in each age group. So we have the children and teenagers. So at this point, their bones are immature. And so what happens is, as their bones are growing and as they're becoming adults, the weakest point is at their growth plate, where the bones tend to grow. And so there's high risk of injuring in that area, like on the wrist, on the elbow. Happens when the children are active, they've begun to walk, they are active, adventurous. And so, yes, so they're more likely to injure their bone at that point, because the growth plate is the weakest point. Then you have the teenagers. Now they are maturing, and then this happens there. Most of them are actually happens in sports, running, rugby, football, whether male or female, and other activities. So this happens with overuse injury, because at this point they are just feel that they can push it. So they might have muscle sprains, strain, and also injury to the probably to the knee, to the foot when jumping, running. So that's what happens. Then when we come to as you're going now to adults, they are now the people who are active in society. And so with the daily activity, working, traveling to various places, like in our country, we have the borders, we have bicycles, we have borders, we have motor vehicles and means of public transport. So the thing that happens most there are fractures. Now, at this point, the bone is matured. And now you have the actual bone that is injured. So it can happen either in the long bones about the knee, about the hands, the back. Yes, so that's what can happen now in that age group. Then as you come to the elderly, at this time now they have a decreased sense of balance, coordination, and now also they have reduced bone density. Or like they have osteoporosis. And so what can be a trivial is just something that you'll just slip and fall. You might not break easily in a young person or an adult, but in the elderly, by just slipping and falling, they can injure their hip. When you fall, you try to hold yourself with the wrist or with the hand, and you break the wrist. Yes. So that's what, and even the back can happen. This is because there's reduced density. So the body with any little injury, any little just tip and fall, that can happen. And so we've talked about fractures that can happen. This is when a bone breaks. There's a sprain that happens, especially on what is called a ligament. This the structures around the joint. It can either be on the ankle, it can also be on the knee. There's also strain. Strain is what happens when there's a muscle has been pushed to the limit, having exercised, not stretching enough, and so you have some overuse of it. You can have dislocation where the joint is not in its normal position, so it's this is out of the location. So it could be in the shoulder, it could be in the knee, it could be in the hip. Then you have tendonitis. So tendonitis is just when the tendon, or what helps connect the muscle to the bone, has some, can I say, inflammation, or just because of the overuse, it reacts, and so there's some pain that can happen. So those are the things that can happen. Now, as we go to the common orthopedic injuries, I think we've now talked about the age group, and I've just tried to allay. What we've had is I'll just list a number, then we can go to them. So we went to children. There is injuries around the elbow that can happen when the children are adventurous. They're running on the monkey bars and they fall down. So they'll fall on their elbow, or they'll fall before they fall, they'll try to hold themselves by nature by the hand. And so with that, they end to injure either the wrist, it's called radius, or distal radius, or the elbow. Then we have for adults, there's the road traffic accidents. That's what happens. It's one of the major causes of financial burden and loss of work, because now you're injured and probably there's been no insurance, or it's been a problem, or life changes. So that is another thing that can happen. These are fractures. Then as you come to the elderly, we've talked about hip fractures that can happen around there. Then we have in the young adults, they're active, they're running. I could be coming from work, and probably it's a weekend, I'm going for a jog at Karura Forest, or running, or I decide to kumkumbusha ujana wangu, and I try to play basketball with young other people. And so I think that I can jump as much, and probably I've not been as active. And so I can injure my knee. There's what is called cruciate ligaments. So those are ligaments within the knee that helps you bend and move as you run and as you jump, as you sit. So that can get injured. And also if you don't stretch enough, you can have ankle sprains. This is what can happen. Then also when you're trying to shoot or trying to reach out to things, you can have some pain on the shoulder. There's what is called the rotator cuff. There are muscles that help you lift your hand up as you're trying to get something, probably from a top cupboard, or shooting basketball, or playing netball, or just any form of sports. Then the other thing also is the aspect of like joint dislocation. So this happens also during, in addition to the road traffic accident, where a joint can come out of its location. So I'll talk about, I can talk about ankle sprains for adults. Then I'll talk about like supracondylar or elbow, like an elbow injury for children. And then I'll also talk about, can I say, just hip fractures in the elderly. So I'll just start with but any questions are welcome in terms of anything orthopedic, so you're welcome. Then there's also what is called carpal tunnel syndrome, whereby this happens with overuse injury, like someone who's used to staying in the computer, they have pain, swelling on the wrist, and there's usually muscles and what is called a nerve that helps you coordinate your hands. So at that point where it passes, it can get swollen, and that happens, they have pain. So it happens in risk factors that happens are there's what is called there's obesity and also diabetes. All this can make someone prone to swelling at that area or any injury that happens around the wrist. It happens mostly around in the adult, young, mid to old adults. And so it's characterized by this swelling, pain, this feeling of tingling that goes from the wrist to the fingers and to the thumb, because of there's a nerve that passes through there and it's compressed. So what happens, those are first I talked about the risk factors, then the aspect of most people the actual cause is not known, but the risk factor is mainly people with repetitive activities of the wrist. So when you're seated on a desk doing computer work, that has been found to be a risk, but yes. So treatment, first to diagnose, it's good to go probably to a orthopedic or a neurologist just to see. There's a nerve conduction study that's done just to check the distribution of the nerve, but also there's a whole examination that's done just to rule out, because you can have some neck issue, a disc that's compressed on the neck, and so it can go all the way to the fingers, and so that has to be ruled out. Treatment, there are a number of things. One is to help reduce the swelling, because it's mainly swelling that's around that tight space. So there are some steroids that are given once the person has been worked up, and it's no risk of the steroids causing harm to the person. There's medication to help with pain. There's some exercises and resting exercises like splints, things that are used to help just relax the hand so that it doesn't have activity. And then gradual physiotherapy, where there's a hand therapist who helps with your exercising of your hand, just to help with the muscles so that they're not as just stay relaxed. Then the last option is surgery, just to release that if that doesn't happen. So that's the carpal tunnel syndrome. The elbow injuries. So there's what is called supracondylar. This is above on the elbow. There's the bone above the elbow and the one below the elbow. So what I'm talking about is the bone above the elbow, but it's just around there. So what happens above the elbow is called humerus. So there's one near the shoulder, the part of the bone that's near the shoulder, and the one that's down here, the distal part just near the elbow. So this happens in young children as they are adventurous, they're climbing a mango tree in the parks or a monkey bar. But the most common that we have seen is children during the school holidays or just after school climbing up a mango tree or a loquat tree, any form of tree, and also just being adventurous and playing, pushing, pulling each other. So at this point they fall. So they fall when to avoid from just injuring, it's natural to just try to hold yourself with the hand. And so when that happens, injury is transmitted and there's a elbow injury, or they fall on the elbow itself. So this happens in the age group, at least from around 3 to around 5 to 10 years of age, around there. So they're adventurous and they're prone to injury. And so what happens is that they come presenting with elbow swelling, pain, and they can't move that elbow because it has been injured and it has broken. And so what happens is that once that has happened, it's good to manage it. It's good to go to the nearest health center, at least they examine, and to avoid much movement of that, because movement will cause more pain and more swelling because that place has been broken, that part has been broken. What is put is a form of plaster or something just to help, not completely. The plaster does not go around the whole arm, but just to help support so that it does not move more and just give time for swelling. After that is done, there's medication that's given at the health medical facility and an X-ray. There's an X-ray that is done, and then you can able to see that the child has been injured. So there are various grades that can happen in that elbow that is seen by the specialist. Yes. And so it's either decided whether it's non-operative, where they might decide first to give time for the swelling. If it is not too much, first what is done before that, to check the child is examined all round if there are any other injuries to rule out. Once the child is safe and it's only that part, management is done. It's either putting just a splint, or splint is just something that is immobilizes the elbow and helps with the pain and swelling and can heal. But if it is too much, what is done is surgery is done to help stabilize that area, because if it is not managed well, issue is the elbow can get stiff or can turn to a certain position, or it can continue swelling and cause more damage to the vessels and muscles of the arm. And so that has to be done. All this is always done serially examining the child, and parent is given education on what to watch out for during management, after management. And so that is important in terms of educating parents. And you cannot say that you put a child inside the house so that they're not adventurous, because adventure is what makes them learn. It's just supervising them in terms of what they do, just guiding them. Yes, so that's what I will say. Coming to the ankle sprains. So this happens in can I say young adults? Or yes, whereby they do running activities or jumping or playing, or people who are probably in the office and not as active, not necessarily that you are not even the active people. So if one has not done enough stretching, they start running or sports activities and they don't have proper shoe wear, and they can injure their ankle. So there's a ligament across the ankle joint. That's the bone that's connecting the top part of the leg to the foot, and that actually causes when it's injured, it causes pain and swelling at that point. So it happens, it's called an ankle sprain that happens. And so it can happen on the inner part of the ankle or the outer part. And so either of those can be injured. So what happens is once that happens, there's usually swelling and the person cannot continue walking as such. So to help treat that, what is done is just making sure that first is ruling out if there's any fracture that has happened or any injury, that there's no ankle injury. And when that happens, once that is ruled out, like there's no fracture that has happened. So with that, you immobilize the leg to avoid more activity. You rest it. You put it high to help just with the swelling. And also you put some ice. So rest, ice, and elevate to like put it on a pillow. And then there's usually a brace that's given just to help with the recovery. There's x-rays that are actually done just to rule out if there's any injury in a hospital setting. There's further imaging that can be done, but initially is just probably an X-ray just to rule out that fracture. If that has happened, a brace is given, and for a period of about 6 weeks, you don't step on it as much, or just protected, having crutches. And once the swelling comes down slowly, at least within 2 weeks or so, the exercises that your referral is to helps with the activation, control of your muscles, or it's called proprioception, how you position your ankle, just to help and strengthening exercises. Yes. And so that helps and relieves the pain.
Mm-hmm. All right. So, Doctor, we'll continue with this. I see that there are a number of fractures. There are really, really many, as you just told me before we even had the on-air experience. And it's starting from the children. It's from a wide array, from children to young adults, even to the older generation. And so in the next hour, we'll continue with this. Okay. And I appreciate the fact that you are telling us the kind of fracture and how to diagnose it, and of course the treatment option there. And even in the next hour, we'll do exactly that. Listener, in case you're joining us right now, this is Breath of Heaven, and we continue with this conversation revolving around common orthopedic injuries. And tonight, I'm joined by Dr. Philemon Nyambati, who is an orthopedic surgeon from AICQ International. At the top of the hour, we will have Fresh with Benny. Then later on, a quick look at the weather, and not forgetting our Artist of the Week, plus a continuation of this conversation. In case you have a question or a comment, I invite you to send it to us to 20933 on WhatsApp, 0717 400 555. Now, we are here once again to express our gratitude, because when we came to you with the idea of spreading hope through the airwaves, one soul at a time, you embraced it and made it a dream come true. By God's grace and through your generosity, we were able to purchase all the equipment needed to broadcast hope and reach one more soul in the Kamal regions of Samburu and Wajir through the Rafiki Mso campaign phase 1. We are deeply grateful for your partnership. Because of you, the message of hope is spreading further than we could ever go. Now, as we embark on this mission, we call upon you once more to help us reach one more soul by becoming a friend of hope. Send your financial gift via our paybill number that is 933933. Send your donation of any amount to our paybill number 933933. The account name is FOH. Let's spread the light of hope one soul at a time. Wewe ni Rafiki Mso.
After a long and busy day, it's time to unwind on Breath of Heaven, your evening companion.
Listen and live on 93.3 FM in Nairobi, 93.9 Western Kenya, and 101.9 Mombasa.
Listen to God. Live with hope in your heart. Listen. Live with hope in your heart. This is so bad. Where you listen and live. Hope FM.
It's now 8 p.m.
Listen and live.
A revival is breaking out.
The voice of hope in the air.
Sometimes just living out our lives can feel like you've been through a washing machine and then a tumble dryer. round and round and round until all the life's drained out of you. Hi, I'm Bernie Diamond, and welcome again to Fresh. One of the criticisms that atheism hurls at Christianity is that it's for losers, a crutch for the weak, so as to speak. But you don't have to be a loser for life to spin you round and spit you out, or a weakling for people and circumstances to drain you of your physical, emotional, and spiritual energy. It happens to the strongest, the smartest, the fastest, the best too. And amidst turmoil, what we desperately need is peace. We crave for it in the midst of the melee. The problem is, when the going's tough, all too often, the things that well-meaning people will say or do for you somehow don't seem to have the power to reach deep down into the turmoil you're experiencing to calm the waters. Or any peace the world has to offer ends up being fleeting at best. You've been there too, right? It's for that very reason that Jesus, the very Son of God who suffered and died for you, has this to speak into your turmoil today. John chapter 14, verse 27. I leave you peace. It's my own peace I give you. I give you peace in a different way than the world does. So don't be troubled. Don't be afraid. And when Jesus speaks his peace into your heart, it comes backed by the very power of God. Listen to me. Jesus can bring peace to your past, purpose to your present, and hope to your future. Jesus. That's God's word, fresh for you today. God's wisdom, God's love, God's encouragement are ready and waiting for you. It's just who he is. So if you'd like to go a bit deeper, then stop by and explore ChristianityWorks.com, where you'll find a wealth of messages on all sorts of different subjects straight out of God's Word, and conveniently arranged so that you can find exactly what you need for today. Again, that's all at ChristianityWorks.com.
Sunny,
Rainy,
hot.
chilly.
Every day we keep you updated. Hope FM weather.
Starting with the capital city tonight, you can expect light rain showers and light winds, lows of 12. Expect sun intervals tomorrow, highs of 25 and lows of 12. Nakuru City, expect partly cloudy conditions tonight and a gentle breeze, lows of 11. Light rain showers tomorrow, highs of 24 and lows of 12. Heading to Kisumu tonight, expect clear sky and light winds, lows of 16. Sunny day tomorrow in Kisumu, highs of 28 and lows of 16. Mombasa tonight, expect clear sky and a gentle breeze, lows of 20. Expect sunny intervals tomorrow, highs of 29 and lows of 20. Eldoret tonight, expect clear sky and light winds, lows of 12. Expect a sunny day tomorrow, highs of 27 and lows of 13. Kisii tonight, expect a clear sky and light winds, lows of 13. Sunny day tomorrow, highs of 26 and lows of 13. Nyeri, light rain showers expected tonight, lows of 12. Expect thundery showers tomorrow, highs of 21 and lows of 12. Finally, in Meru, expect partly cloudy conditions and light winds, lows of 13. Expected drizzle tomorrow, highs of 23 and lows of 13. That's your weather update, courtesy of BBC Weather.
Speaking so is a promise of our end that reaches and goes beyond. Watangaza tumaini kote.
Thank you for being a friend of hope. To donate, kindly use the M-Pesa paybill number 933933, account FOH.
breath of heaven. Settle down to a night in God's presence with the most awesome praise and worship music.
Artist of the Week on Breath of Heaven.
East went looking for west, but never found him. You went looking for my past, but only found love. Heard about a sea where sin sinks like stones. There's no floor there, just mercy down below. There's so much grace. There's so much grace. There's so much grace. There's so much grace. Heard about a man with holes in his hands. He can hide mountains of sin and then his smile destroyed my religion. His love shakes down my prison. There's so much grace. There's so much grace. There's so much grace. There's so much grace. I could run for my days, but I never run away. There's no mistake I could make that could ever make you change. I could run for my days, but I'll never run away. There's no mistake I could make that would ever make you change. There's so much grace. There's so much grace. So much grace. There's so much grace. There's so much grace. There's so much grace. There's so much grace. So much grace. So much grace. So much grace. Vast weight of this grace washes over me. Washes over. So much grace.
Great music there from Jonathan and Melissa Helsa, the song So Much Grace. Playing on Hope FM, Listen and Leave. It is now 11 minutes past 8. We are on the second hour of Breath of Heaven, and this night we are learning more about the health of our bones, specifically looking at those common orthopedic injuries and their treatment. And of course, we are live on Facebook and on YouTube as we carry on with this conversation. And Dr. Philemon Nyambati is with me, and I see another doctor is here with us, Dr. Federico, also from AICQ International, and we'll be talking to him in just a little while, getting to find out how he has been. But in the meantime, Dr. Nyambati, we'll continue with the areas that you have touched on, especially regarding the orthopedic injuries, and the one that you really want to touch on, rather, the thigh bone and so on and so forth. Then we'll carry on from there.
Yeah. Okay. Thank you.
Yes.
So we had talked about just elaborating based on the age group. There was what is it called? Elbow injuries around the elbow. Those injuries around the wrist. And also now we'll talk about in the elderly, those the hip fractures. My colleague Federico will talk about thigh bone injuries.
All right.
Yes, and we'll continue from there. So fractures around the hip in the elderly. So this, as I said earlier, at this point they have loss of coordination, balance, and another thing is that the density of their bone is reduced. And so just with a trivial fall, just asleep in the bathroom, which a young person will just rise up to, they are not able to, they can easily injure their hip. And so the hip can break. And also the other thing that can also happen even around the spine. And so when this happens, because in young people, for the hip to fracture or to break, what can happen is that you need a high energy injury. Either it's a fall from a very very big height, or a road traffic accident, or some injury. So in the elderly, what happens is that when they have that trivial fall, they have pain and they cannot move. And so for them to be diagnosed, they have to be at least to be in a health facility, hospital, emergency department, and they are seen because what they present with is pain, they cannot move, and also because of the pain and everything, they can't take care of themselves. And so what happens in the emergency room, when they are seen, imaging is done, an x-ray, and actually it's taken around the pelvis, and you're able to see that other things are taken into consideration. The health of the patient, they can either be very big or very lean, and so also their nutrition may be affected. So once that is diagnosed, it could be, if they're younger, there are implants that can be, surgery is done. That's what I will say. It's good to manage them surgically, but before that, because for the elderly person, they have other things that they could have, what is called comorbidities. Either they could have renal problems, they could have hypertension, all this. So it is a multidisciplinary approach. The person is not managed just by a single health professional. So the orthopedic surgeon is involved in fixing the bone so that they're able to walk again. But the things that are taken into consideration is the nutrition of the patient, managing if they have any kidney issues, if they have any hypertension, all that has to be managed. And also after surgery, because the risk of when elderly person has a hip fracture, there's high risk of getting clots, and so there's also medication that's given just to help so that the blood does not clot. Also, the rehab specialist is involved so that the person can start walking independently, or at least assisted. Yes, so that's what I would say.
All right, yes. So now we talk to Dr. Federico.
Yes.
Welcome to the studio.
Thank you so much for having us. We're just back from a mobile clinic So it's nice to be back. As my colleague said, it was a great introduction. Now we go to the practical things. There's different ways that we can say an aged person or an old person. Nowadays, people don't feel old. When like maybe 50 years ago, if you would say, "Oh, someone is 70 is old," right now people will get offended because life has been changing, things are different, and there's people that are very healthy and they are over 80 right now and they're still running and they are active. So when you think about of a fracture, you have to think about how is the person, is not just the age, is the number, but you have to think about the biology that is behind. That could be a 70 years old that has multiple pathologies, multiple issues, and is to be considered old. And there is 80 years old that is really active, is playing sports and stuff. So despite the number, it might be younger than the 70 years old with other issues. So you have to treat it accordingly. And when you treat a hip fracture, you have to think about the mental status of the patient. So there are some patients that after the surgery, they would not comply with any of the instructions that the physiotherapist would say. So you have to think about it and change the treatment, because there are basically two types of treatment for hip fracture: either to fix it or replace it. Okay, so the fixation depends on where the fracture is. Let's say that the closer it gets to the socket, so the hip is a ball and socket joint. The ball is the femur, which is the thigh bone, and then the socket is the acetabulum, which is the pelvic bone. Okay, so the closer it gets to the socket, the more likelihood to replace the joint. Okay, the farther that it gets, then the more probability of fixing the hip. So two ways of fixing the hip is with a plate and screws or with a nail. Nails have become more and more common in the last years because you can tell the patient to bear weight after the surgery, because it's very hard for a 70 or 80 years old not to bear weight after surgery with crutches. So we need to do a treatment that allows the patient to walk after, to bear weight. Okay, because it's very, very difficult, especially if you have some form of instability before. So those are the two types of fixing the hip. Now, if the fracture is closer to the socket and the patient, it's right now we say above 70, 75. Sometimes you can attempt to fix it, depending on how the patient is. Now we have to replace it and to put a total hip replacement, which means you change the ball and you change the socket. Or if the patient is old, let's say like it's over 90, life expectancy, even in the best condition, it's hardly to be like more than 10, 15 years, even in the best conditions. We have a region back home in Italy where people live, like the mean age of survival is 88. So it's really long, because they live on the seaside, and there's not just Mombasa Raha. There's everywhere. Also in Italy, people that live around the sea, they live slower, but they live longer. So the chaotic Nairobi has less likelihood of living a centenary life, while Mombasa life, it might be like slower but longer. So it depends also on all these things. So let's say, if someone is relatively young or very active, you change the joint completely. That is called total hip replacement. Now, when the patient is old, now it's called hemiarthroplasty, which means that you change the ball, but you don't change the socket, which means less bleeding, less surgical time, and eventually potentially less complications. So the patients that have many issues before, then they are more likely to get a partial joint instead of a total joint. So those are the most common treatment for such a thing. And I think the good thing that I've seen here, all the implants are available, though the issue sometimes is the cost, because there are some implants that cost more than others. But it's not just because of marketing; it's also about the type of material and the longevity of the material. So whenever someone of your family get this question, think about that the price is not just because of the doctor wants to charge more. It's also the implant cost, the material might be safer and last longer than that. So whoever can afford it, most of the time is worth it, because the material might last longer without changing the joint again. So those are all the things that we have to take into consideration. And then especially for people that have dementia, Alzheimer, that is even more difficult, because they can't cope with the instructions afterwards. So we want a treatment that gives stability, less bleeding, and the ability for the patient to walk right after the surgery and be back on track on their activity. Yeah.
Thank you for that elaborate explanation there. And I'll go back to Dr. Nyambati. And,
Yes. Yes.
You talked about a couple of, common
Yes.
injuries there. We call them orthopedic
Yes.
injuries. And you would like to touch on one more again before we head to the questions. I see the questions already coming. You can go ahead.
So there's femur fractures. So this happens in, it's one of the most common injuries because of the young population. People are active, traveling with motorcycles, motor vehicles, building. So there's high likelihood of injuring the thigh bone, it's called the femur or the thigh bone. And so when this happens, it's a high energy injury, which can happen with what I've said earlier. And also with the onset of border borders, it's one of the most common injuries that happens around our country. So what happens when this happens is that the thigh bone is quite a long bone, and that's what helps us walk, and it can break at any point. It can break closer to the hip, it can break in the middle, or it can break near the knee joint. And so when this happens, it can either be the bone can break and not come out of the skin, or it can come out of the skin. And so when this happens, there's usually swelling, pain, a person cannot move. And this can also happen with other injuries. This is just one of the many other injuries that can happen. They can have injury to the chest, the ribs are involved, the abdomen, the back, the hands, the upper limbs, and also even the lower limbs. And it can have other things, because the thigh just does not only have the bone by itself. There are muscles, there are blood vessels, there are nerves, and there are the joints. And so what happens is that when the injury happens, a person is taken to a health facility, and a team approach is done in the emergency department. The most important thing is first making sure, is that injury open or is it closed? And then also, what is the stability of the patient? And so there's a team that is involved, either the general surgeon or any person that is there who's specialized, and they assess the person, checking the airway, that the person is breathing, the neck is stable, there are no other injuries into either the pelvis or the stomach or the chest. So all this is done, and just to make sure that the person is stable, and also just to help with pain, especially if the fracture is closed, that it is not poked through the skin. There's what is called a splint that's put just to immobilize and relieve pain and give medication. If it has poked through the skin, the person has to be given antibiotics just to prevent risk of infection, and it's immobilized as they're going to an imaging room. At the same time, there's also a team of surgeons that not necessarily, there's the general surgeon and the orthopedic surgeon also who come hand in hand in managing this patient, because at that period there could be any either abdominal injury or chest injury which has to be managed. So when that has been diagnosed on X-ray and all other injuries have been ruled out, if it's an open injury, that's called an open fracture where the bone has poked through, there's usually management that's done. It's important to stabilize the bone and make sure that any dirt that's present has been washed out. First, there's actually a consent that's taken by the patient and also the next of kin, just so that this is done. Stabilization is done and just checking out that there's no vascular vessel injury. The muscle is okay, and also the skin. If the bone is outside and there's a lot of dirt and probably the skin is not able to, there's not enough coverage, there's also a team that helps to cover that. And then there's stability that's done. You can do an external device where things that look like an area, it's called an external fixator, just to help. And also we have implants that are put within the bone, inside the bone itself. Either it's a plate or a nail, just to help with stability. And after that, first also the status of the patient is assessed if there are any comorbidities. But that's what I was talking about, was just the young population in this instance. With that, they're able to start walking and given with the assistance of a physiotherapist, and they with either with crutches, and with that we begin the process of healing so that they're able to move their joints again and be active members of society. There's a anti-clotting medication that's given just because there's high risk with such long bone injuries to have clots, and so there's what is given to the patient for a period of time as they recover.
All right.
Yes.
Thank you, Dr. Nyambati. And we'll continue with this conversation in a little while, but we also want to check from the listener the questions that you are sending in. What you can do in case you're joining us right now, send your question or your comment to 20933 20933 on SMS line, on WhatsApp 0717 400 555. And right now, I just need to let you know this is going out to all women and daughters across the 47 counties of Kenya. Here is a clarion call to join hands for a day of humility and heartfelt prayer for our nation this coming Saturday, the 27th of July, starting at 9 a.m. WapraNet Kenya, in conjunction with the following prayer ministries, that is 14K, WWK, and FBG, are calling on women in the nation to engage in prayers of repentance and wailing for the state of our nation, according to Jeremiah chapter 9, verses 17 to 21. You are free to gather in your local assemblies and take a prayer walk or drive through the length of your city, towns, or villages, that in wrath God may remember mercy. And during this particular time, the dress code is preferably white. For more information, call 0724 127 that's 498. I repeat, 0724 127 498 or 0723 458 414, 0723 458 414.
After a long and busy day, it's time to unwind on Breath of Heaven, your evening companion.
Hope FM exists to know God and make Him known through evangelism and discipleship. For feedback, suggestions, or complaints regarding our programming, talk to us on 0709 861180 or email us on feedback@hopefm.org. Reach us through our social media platforms at Hope FM Live. We would like to thank you, our listener, for your continued support. Hope FM, listen and live.
Listen and live today, tomorrow, and every day.
Recharge.
Great is thy faithfulness, Master. Great is thy faithfulness, oh Lord.
Activate.
My heart was heavy this morning, but after the prayers, I felt an ease. The testimony right there.
Amen. Praise Junction.
Anybody wanna pray with? Anybody wanna?
Afternoon switch.
I always want to be involved, so that is how I guess I got the confidence.
And learning on the job is actually the real learning.
Tunajua anakuanga na baby hair.
Baby hair. Baby hair.
Anakuanga na baby hair.
Baby hair,
Baby hair.
Breath of heaven.
Despite facing rejection, silence, and seemingly harsh words, she refused to give up.
Listen and live today, tomorrow, and every day.
Hope FM. We get to listen and live all day long. Need dialysis, cancer care, or a minor surgery? Usiende mbali kutafuta specialist. Tuko kwa mtaa wako. Aga Khan University Hospital has brought specialized care near you at our Roy Sambu Specialty Center, located at the Jewel Plaza at the Roy Sambu Roundabout. Some of the services available at the Roy Sambu Specialty Care Center include dialysis, chemotherapy, daycare surgeries, and endoscopy. Specialists available here include an oncologist, pediatrician, gynecologist, gastroenterologist, general surgeon, ENT, and internal medicine specialists, among others. At Aga Khan University Hospital, we believe quality specialized care should be accessible where people live and work. For more information, visit us at Jewel Plaza opposite the Roy Sambu Roundabout. Aga Khan University Hospital. World-class care, here and now.
Hope FM, another quality service from Christ, is the answer ministry.
Shauku la moyo wangu, shauku la moyo wangu, shauku la moyo wangu, ni kukupendeza, nijue njia zako, tena nikufahamu. Shauku la moyo wangu, ni kukupendeza. Shauku la moyo wangu, sema shauku la moyo wangu, kukupendeza. Nijue njia zako, Baba, Nisha nimetamani, nalo nitakamia, nikae hekaluni mwako. Baba, nikuone katika uzuri wako. Shauku la moyo wangu, ni kukupendeza. Shauku la moyo wangu, shauku la moyo, Baba naomba, ikiwa nimepata kibali mbele zako, naomba unionyeshe njia zako Bwana, nitafute uso wako kwa moyo wangu wote. Shauku la moyo wangu, ni kukupendeza.
Absolutely amazing song there from Lydia and Jerry, and the song is titled Shauku la Moyo Wangu. It is now 23 minutes to 9 o'clock. You are tuned into Breath of Heaven. This Thursday edition of the program, and we are talking matters health of our bones. Case in point this night, looking at common orthopedic injuries. Dr. Philemon Nyambati and Dr. Federico Sibona are joining us this night. They are orthopedic surgeons from AICQ International to discuss this matter. And so your questions, I see them coming through. We'll be looking at them shortly. I want to appreciate my good colleague here. He's joining us from Wajir. We are actually live in Wajir. We acquired the frequency recently. And so thank you, Frank, for letting me know that you're receiving us loud and clear there. As we said, thank you to you, our friend of hope, for being so kind to support us to ensure that we carry on with that. Let me check now the questions coming through. This one is from a listener who is seeking to find out, saying, please ask Doc if spondylitis and disc bulge can be cured without surgery. That is Job from Bungoma.
Thank you for the question, Job from Bungoma. So spondylitis is a condition that happens whereby there is wear and tear that tends to happen with age, and it can affect the spine and the hips. So spondylitis is broadly classified into two areas. There is axial. So with axial happens around the spine and the hip, and then there's peripheral. So that happens around other areas. So it can be in the abdomen, like in the gut. It's called enteritis. There's the urinary bladder. There's the eye, and the hands. So that's what can be broadly classified. So with spondylitis, what happens is that the bones, by some unknown reason, they fuse and result to pain. And there's a protrusion of bone that's called osteophytes that happen in between the joints of the hip or of the what is called the sacroiliac. There is the joint around the pelvis that's called the sacroiliac joint that can happen, and on the spine. What causes it? Experts are yet to know what really causes it, and its ability to be cured has not been found, because the major thing is inflammatory cells, or the cells that help fight in case there's an bacteria. Now they attack the aspect of the joints. So it's called inflammatory arthritis. And so there's no curability for it, but what is done is management. And so with this, what is done is first to diagnose it. It's based on the patient's complaint. They might have for a period of about 6 weeks where they have stiffness, pain, and ability to move so much. And it especially in the morning, then it comes down slowly. Then for diagnosis, x-rays are done just to check around the joints how they are, and even other further imaging that checks how the soft tissues are. Major mainstay of management is medication, painkillers, non-steroidal anti-inflammatories. So just to prevent the inflammation, because that's what happens around the joints, and also steroids that are given. It's good to see a rheumatologist just to diagnose and just help with management of this. If it's still very stiff and around the joints and you're not able to move as much, the surgery that's actually done. So if there's any way of treating spondylitis without surgery, yes, it's possible. There's use of I talked earlier, non-steroidal anti-inflammatories and steroids, and also trying to recover the activity or move the joint as much as possible, just to help so that the muscles don't get stiff. So that's the treatment. As for the disc bulge, so what happens between it's called the vertebral column of the spine. There are bones that are actually encompassed. So from the neck, that's what helps you turn. Then along that's called the cervical vertebra. There's along the thoracic, where there is the rib cage that encompasses the lung. Then there's the lower back. That's what helps you turn, twist, bend, push, pull things. That's what attaches now to your pelvic bone. And so between those two, the many bones around that, it's called the vertebra, there is what is called a disc. So that's like a cushion that actually helps as a shock absorber as you walk around, as you move things. And so what happens, there are many things that can cause a disc bulge. One is how we push and pull things, because and also our activity. If you sit for a long time, there's a lot of pressure that happens on the lower back, which is called the lumbar, and that increases the pressure into the vertebra, and the disc is pushed out, and that's what happens. It's called a disc bulge. So the spinal cord is not, or rather the spinal column is composed of bone, the joints within the spinal cord, and within the spinal column and the spinal cord. So when there's bulge, it can push because it's a smaller space, so it pushes out and can cause pain onto one of the nerves that can actually go to the lower limb. So this happens now either with how we push things, pull things, because you're supposed to squat when you're lifting things. You're supposed to put one leg in front as you push, so that you use your core muscles or the abdominal muscles and not your back muscles. All this now can predispose or put person at a higher risk of a disc bulge. So when that happens, when a disc bulge happens, you can have severe pain at the back, and there's radiation, or then the pain goes all the way, like feeling of numbness or burning sensation that can go to either both legs or one of the legs. It can also go to as worse as having problems with urination if it compresses so much. So treatment, first is based on clinical examination. You see the doctor, they're able to check first if there are any other injuries, if they just rule out infection, or if there's a tumor. Those are called red flags that are ruled out first. If there's excessive weight loss, if there's that, because also this can be differential, just also possibilities. If that is ruled out and it's only the disc, there are ways of looking at it. There's the non-operative treatment. If the disc does not cause any weakness of the legs, if it does not cause any weakness of the legs, incontinence to urine or stool, then that you can do non-operative management. Or if it causes that first, it shows that it's an emergency and you need to remove the disc at that area. But if it does not and it's just radiating, but there's still activity, there's the aspect of going into non-operative treatment, whereby the physiotherapist is involved to help with back stretching exercises. But before that, first it's medications to help relieve the pain. First, when a disc bulge comes out, it's, if you can remember, when you think about toffee or the eclairs, when you poke it, there's some gooey chocolate that comes out. And so that's the example. So the coating around the sweet, that's the eclairs, but the gooey chocolate is the disc. So the disc does not really come back, but you can manage in terms of to help with the swelling. And so physiotherapy is done to help back stretching exercises, medications to relieve pain, and if there's any place that's compressed by the disc onto the nerve, You're given medications to help with that. At least you need physiotherapy for a period of 6 weeks, and we follow you up. If still there's no improvement, we need further imaging just to rule out if there's any other thing that's causing. And also what is done is a steroid injection that is given into that space just to help to relieve that pain. If it still persists and there's difficulty in doing activities of daily living, then you'll have to have a discectomy where you remove the disc at that point. Yes. So there's the non-operative where it's possible to manage, but if it reaches a stage where it's difficult and or causing disuse, then you may need operation. Yes.
Right. More questions are coming through, Daktari. Let's look at this one here, who sent a little earlier on and wanted to find out about this sharp pain, saying, thanks for the show. Please ask our guest why I always experience a sharp back pain and also swelling on the legs, the pain that you cannot even bend. It's not a regular one. I only experienced it once.
So sharp back pain, there are a number of things that are involved in the back. So there's the muscles, there's the fascia, or the covering of the muscles around there. There's the bones itself, there are the muscles, the nerves, and there's the disc. So sharp pain that just comes and focuses on the back probably would happen. It could be probably something from the muscle or just a strain that could have happened. It happens with push, pull, how we push things, how we lift things, how we sit. Probably you're seated in the house. Just think about a scenario. You sit from your house, either in the car or in the matatu. You get to work in the office, you sit. Then when you finish, you go sit for lunch or sit for tea break. Then when you finish, you sit, go back to the matatu, go back home or to the car. Then when you come to the house, you sit on the couch and watch television.
Too much sitting.
So when you think about it, you're not as active. And then all of a sudden, there's been no much exercise. And so also weight also predisposes to this cause of activity, loss of activity. And so also our muscles and everything is changing. So all this predisposed to back pain, how you push things, how you lift things, because you're supposed to use our core muscles when lifting. Pushing things, you're not supposed to sit for very long. We're supposed to at least walk around and stretch. And so when sharp pain happened for that gentleman, most likely it was more of muscle pain that could have happened. And that's what probably came once. Probably it's how they twisted or how they lifted things. Then all of a sudden they had sharp pain, or as they were sitting and as they woke up, they could have had a sharp pain. If it was for a day, probably the best would be some medication to help with pain or a muscle relaxant. But if it's something that persists, it will be good at least to see a specialist and just know what it could be. As for the swelling, what happens with swelling, there are a couple of things. It could be either by sitting for long or standing for long. With age, what happens is the lymph does not go as much. We have what is called lymph, mshipa ya maji. That's what we try to explain as that. So the lymph does not go high as much, and so the feet and the legs swell. But there are a number of things that can also cause that. First, it's your activity, sitting for long or standing for long. You need also to rule out other things. Could be either a heart issue, could be a kidney issue, liver issue. So other things can also be causative of that. Usually, if it's just pure swelling with no other symptoms, once the specialist has ruled that out, the most important is actually activity, not activity rather, but there are compression stockings that actually help with bringing the lymph up. Then also just lifting the leg, lifting up the limbs just to help when the person is not active. So those are the things that are talking when he's talking about swelling. Yes, hope I've been answered there about disc bulge and swelling.
All right.
And back pain.
All right.
Yes.
So we carry on. I see even Dr. Federico has joined us. Well, we are looking at the questions sent by the listener. And so let's carry on with this one here on Facebook. Betty Aching says, tuned in from Gando. My mom has a lower spine issue which has affected her movement. She experiences pain on her thighs and hands. She can't hold anything. This came up as a result of the work she was doing. She has been under medication. We've done X-ray and MRI, but no changes. How can she be helped? Probably Dr. Federico would like to attempt that one.
So it's difficult to say something in this condition, as what she mentioned was just some exams that she did. So that's not the treatment. So first you need to understand the cause, because back pain, not unless is the pain from the neck or from the upper thoracic spine, let's say the chest, the vertebrae, the bones that are at the same level of the chest, can hardly give hand pain. Okay, so lower limb like leg pain can be given by back pain, like compression myelopathy, that can be given this kind of combo of upper hand issue or lower limb issues. So but this in the MRI should be highlighted, because if someone has a compression myelopathy, so basically the canal where the nerves are in becomes smaller. So that gives symptoms on the lower extremities when it's let's say on the lumbar spine, when it's on the back down there. But when it's up, can give also symptoms to the hand. So that might be a cause of that. Or depending on the age, she might have some compression syndromes, like a carpal tunnel or cubital tunnel. So that's hard to understand. That can come up with an electromyography, which means that they do the tests on the nerves of the hands, so that they can give you that result if she's having like back pain from a problem from the back, and hand pain because the problem is caused from the nerves, the peripheral nerves, not coming from the back. Or she can have a double problem, higher up on the spine and lower down on the spine, that can give both issues. So if she's done the MRI, especially for the lower limbs, this has to be given something wrong, because otherwise it's not possible that the back pain can cause lower limb numbness and pain without being noticeable on the MRI. For the upper extremities, if it's negative, the MRI, this means that most likely it's a peripheral nerve that can be given a diagnostic with an myography, and then the treatment can be done. And most of the time, especially for peripheral nerves, it's surgical, because if there's a compression of the nerve on the wrist or on the elbow, you have to decompress the nerve to solve the issue. Hopefully this at least has helped a bit to understand which could be the cause of what she's saying.
All right. Wow, let's look at another question here. And this one is from a gentleman. His name is Ken. And he's saying, how do you deal with, is it sciatica pain? Sciatica pain.
Sciatica.
Oh, okay.
Oh, sciatica.
Oh, yeah.
Sciatica.
Sciatica.
Yes. So it's a pain that starts from the buttock all the way to the foot. So this can happen by a number of factors. First, it's one could be either it could be higher up on the spine, on the lower, where a disc is bulging and is compressing onto the spine, or rather onto the nerve itself, and that can cause pain that goes from the buttock all the way down. Or it could be compression on the sciatic nerve, where it's compressed. There's some compression around the buttock, either by some bulging or injury that can happen. So How it's diagnosed for sciatica is whereby first the person complains of pain that goes from the buttock all the way to the foot. They feel hotness or numbness, feeling of tingling onto the foot, and then when they cannot walk for very long because they feel some sharp pain that actually goes down. So that happens with a bulge of the most common is a disc bulge that compress the nerves. Either can go to the left buttock or to the left side of the limb or to the right side. So before treatment, there's an examination that's done whereby the doctor puts the patient on a couch and they bend the knee and bend the hip, and they try to extend or make the leg straight. If it's sciatica or any compression, they have some sharp pain that goes from the buttock all the way to the foot. They cannot move as much. First, other red flags are ruled out if there's any tumor or any infection that's ruled out, and what is done is an X-ray just to rule out if there's any back issue. And then also imaging called an MRI that checks the muscles is ordered for, just on the back, just to rule out if there's any bulge. Most likely there might be a bulge. And so with that medication, where there's the non-operative treatment, first it depends on how long this has been there, and ruling out is there any weakness or is there any incontinence to urine or stool, because that, if there's any of that, it's something that's urgent that needs surgery just to decompress the disc itself. If it's just pain that happens, there's a non-operative treatment whereby medication is given to help with the pain and just reduce that swelling, and medications just neurotropic things that are help with the nerve, with the pain. And there are exercises to help stretching exercises that can be given for the patient for at least a period of about 6 weeks. If it's something that's still persistent, it will be good probably to think of some surgical management. Yes.
Oh, time flies when we are learning all the more. And so I take this opportunity probably to invite Dr. Federico. Your concluding thought on what we've been discussing on those areas, matters common orthopedic injuries, because time wouldn't allow us to look at all of them. And then Dr. Philemon Nyambati, you will conclude by telling us how somebody can get in touch with AICQ. So, Dr. Federico, your concluding thoughts.
So, despite we are talking about different topics every time, the questions are mostly on back pain every time, and arthritis either of the hip or the knee. So, what we want to underline in this space that we've been given, thank you to OPFM, is prevention makes it all. So being active, walking at least 30 to 45 minutes a day at a good speed, especially for the ones that live in Nairobi, it's helpful, because since these modern jobs have come, back pain has risen up a lot, because in the countryside, despite the work is having much more load, many people are lean and they don't have such pain. They tend not to have arthritis and back pain because they've been active their whole life and not overweight. Weight is a very consistent factor on people that have such issues. So most of the time, I would say, if we've been able during our lives to live a healthy lives, which means being active the whole life, most of this problem can be prevented until a very late age. So what I advise is to be active, to avoid having these issues in the future, because when you have them, then it's difficult to, especially for back pain. Right now, the technology has allowed, especially with total hip and total knee replacement, to really give a very good quality of life when you have such issues. But for the back pain, prevention of surgery is still the main thing that will help us in long-term healthiness in such a thing, and leaving the surgery as a last resort. Thank you.
All right. Dr. Nyambati, how can somebody get in touch with AI Secure?
Okay, so getting in touch, there are two places. There's the Cure Nairobi Clinic. The contact is 0733 790 421. I'll repeat, 0733 790 421. At our hospital in Kijabe, there's a Cure Hospital. It's 0733 770 653. Our email is info@curekenya.org. We operate from Monday to Friday, 8:30 a.m. to 4 p.m.
Thank you.
Also, just before that, the thing I was thinking about also, as when you talked about prevention, it's as you're active, it's good to have proper shoe wear in the house, at least making sure that having a rug that's not slippery, or a place that is easy so that one cannot easily slip and fall, and also warm up before exercising is a must. So this can help prevent such injuries, and also policies in terms of make sure you that have a helmet, obeying traffic rules for motorcycle and motor vehicles, and this can help prevent orthopedic injuries. Thank you for the opportunity. We really enjoyed, Federico and I.
Thank you so much.
You're welcome. And tonight we hosted Dr. Federico Sibona and Dr. Philemon Nyambati from AICQR International, talking to us about the common orthopedic injuries and also answering your questions. God willing, we have them soon again coming to share with us more on that. In this hour, we have reflections, prayer focus, and from the scriptures.
Hi, this is Carol from the Celebration Choir.